We're here at the Outline Skincare Clinic in Droitwich today, watching Jo, our therapist, perform a fire and ice peel on one of our patients. The fire and ice peel is a superficial peel that's made by IS Clinical, innovative skincare, and it's a feel-good facial that people have for resurfacing and giving the skin an extra glow and radiance. It basically improves complexion. So Jo at the moment is cleansing our patient. Perhaps Stacey, you could tell us why you are having the treatments and how you found they've benefited your skin.
Yeah, no problem. I suffer from acne years ago, but I say I get regular spots. So it certainly helps with the resurfacing of my skin. My skin's very dull, and I do find that if I don't have these on a regular basis, my skin doesn't seem to shine as much. So I do find things very helpful and beneficial.
Has it helped your spots?
Yes, definitely.
Yeah, it's reduced.
I don't actually get spots anymore thanks to these. So.
Well, that's good news. So Jo's just done a basic cleanse here, and she's about to perform the first part of the peel, which I think is, if I'm not wrong, is the fire part. Is that right, Jo?
It is. So this is actually referred to as the intense resurfacing part of the treatment. So this is actually to help turn over the skin's, renew the skin, get rid of any of the horrible old deposits that are sitting on the skin, and really give it that freshness. It's quite often actually referred to as the fire side, because what you actually find is that it can actually feel quite hot as it goes onto the skin and a bit tingly, but nothing that's that uncomfortable. So first of all, I'm just going to actually put these little protective eye pads over Stacey's eyes. I'm not actually going to apply the resurfacing mask to the eye area, because the eye area is very, very delicate. But when it comes to the hydration, the ice part of the treatment, I will then actually go right up to the eye area to provide some hydration there. So we've got Stacey ready here. Now the cleanser in the IS Clinical range, the cleansing complex, what that actually does is it prepares the skin for the mask to go on there. So I'm actually now going to start applying the resurfacing mask to Stacey's skin, and I'll start at the forehead and I'll get this on.
Am I right in thinking that this is sometimes known in the celebrity press as the Hollywood red carpet facial?
It certainly is, but obviously it's a lot more expensive if you're actually going to a clinic over in Beverly Hills. So this is something that quite often that they'll pop out and can actually go and have done, and then could be filming again in the afternoon.
So it's like a lunchtime procedure.
Absolutely. But very beneficial, and also starting now to replace some of the masks where you've got the deeper downtime of having to perhaps have 2 weeks off work. This is a really nice way of freshening up your skin, but with the hydration part of this, which will follow on in part 2 of this clip. And what that will actually do with Stacey, that will put the hydration in, so she will not have that downtime of flakiness of the skin. And here I am, you see, as I'm just actually applying it all over to the areas.
And is this a procedure that somebody could have for a special occasion, or would you need to leave a certain amount of time?
I would generally say if you've got something like a wedding or something like that coming along, I would say really kind of have it done about 4 days before you're actually due to go to the wedding, because what it will do is it will continue to work, you see. So while Stacey is having this done today, and today she'll have a small amount of redness, nothing that would stop her going back to work, but what it actually will do as well is it will continue to work over the next 2 to 3 days, and it's quite normal that you'll experience where the skin will feel tighter, fresher, and start to have like a really nice healthy glow about it. So what I've done is I've applied this actually, as you can see now, to Stacey's facial area. Whilst I do actually apply some hydration to the neck area, we don't put it on this skin because that skin is actually too delicate. Now Stacey has been having a course of these, so she's quite experienced with this, and I would actually be now timing Stacey for 6 minutes, for this product to actually start taking effect. Normally, however, I would start somebody off on 3 to 4 minutes and build them up so that they don't feel that it's too intense or too hot on their skin. When I come to the end of this 6-minute filming time now, I will then apply the cleansing complex yet again to the skin, and what that actually does is that actually helps neutralise this mask. So this actually breaks it down and again soothes Stacey's skin.
Does it feel warm, Stacey?
I'm kind of used to the heat now, if I'm being honest, so it doesn't feel warm to me at the moment, but it's definitely not unbearable. You just feel a little bit of heat towards the end.
Lovely.
If a patient does find it slightly uncomfortable, what I can do is just actually whip this brush over the skin.
Yes.
So if they're having that little bit of a tickling heat sensation, that actually removes it for them.
Lovely. So Joe's going to leave this mask on for about 7 minutes. So we'll come back in part 2 because nobody just wants to sit and watch paint dry, I guess. So we'll stop the video now and come back when we're about to remove the mask.